Good morning. Today is the first interview for our new monthly discussion called Let's Talk About Health. To start us off on this new program is Dr. Jacob Minang. He's our executive director. I'm Karla Robeson, and I will be presenting the questions. Dr. Minang has a professional history of medical and immunology research. He has a master's degree in biochemistry, a doctorate in immunology, and publications on human immune responses in individuals with HIV/AIDS, malaria, contact allergy, and anthrax. And that's just a little bit of his background. Jacob, thank you so much for being here this morning. We have a lot of questions today regarding the pandemic specifically, and some very specific ones about COVID and the vaccine. Are you ready?
Good morning, Karla. It's a pleasure to be here. I'm excited to talk about this topic.
Well, thank you. So we have asked several employees to submit some questions that are particularly puzzling or troubling for them. And we understand that coronavirus refers to a whole section of viruses. But what the question I've received is, why is this particular form of coronavirus, COVID-19, so much more dangerous than the others?
Yeah, so as a scientist, we only give information based on data. It's data driven, but we have to guess, of course, before doing any experiment to come up with data. So based on what is known so far, it's a respiratory virus like most other coronaviruses, but the difference is in the type of cells it infects and the organs that it tends to affect, and the people that are vulnerable to the virus.
Oh, what are some of the other forms of that coronavirus group?
Yeah, a seasonal flu. It's a coronavirus. The H1N1 that we had before, that was caused of the pandemic, that was less severe than this. It's also a coronavirus. But there are significant differences in their infectivity and the target population and the type of cells that they tend to target in our bodies.
Oh, okay. So it's really how that virus targets us. We keep hearing about different treatments, different ways to treat this, and it seems to change. Why are we hearing about all the changes in how this COVID-19 is being treated when people become ill?
Okay, the first obvious reason is because this particular virus strain is new. So we didn't have medicines against it sitting on the pharmacy shelves when it broke out at the end of 2019. So scientists and pharmacists and pharmacologists had to figure out a way to come up with medications that are specific for this. And so the first obvious thing that they had to do was to get into the shelves and pick up all antiviral agents that they had that they hope might be able to prevent this virus, while trying to develop new ones. And that's why the different treatments have been changing over time the last 1 year. So at the beginning, there was a lot of talk of hydroxychloroquine and then remdesivir, and even some strange suggestions like ivermectin. And now some companies are able to produce antibodies that are actually specific to this strain. In addition to targeting the virus specifically, clinicians have also tried to target the symptoms. So clinicians have had to give steroids for people that have an exaggerated inflammatory response. They've had to give antibiotics to people that have pneumonia because they assume pneumonia comes together with bacterial infections. So they control the secondary infections that might come due to the infection of this virus. And for people that have severe headaches, they've had to put them on anti-headache medications. They've had to put them on ibuprofen. Wow. And people that have body aches, they have had to give them. So a lot of the other treatments have to do with chasing down the symptoms that vary from individual to individual.
Wow. So you've mentioned remdesivir, and we're hearing a lot about remdesivir. How does that actually work?
Okay, so remdesivir was actually developed as an antiviral agent against Ebola, the Ebola virus. Remember, 4 to 6 years ago, we had the Ebola that it was endemic in West Africa. It started in West Africa and Liberia, But one person unfortunately came to the US with the infection and got hospitalized. While at the hospital, this person infected a number of nurses and clinicians. And by the time all was said and done, we think about 4 or 5 people were infected in the US. One person eventually died. So Gilead Sciences developed remdesivir that was specific for the Ebola virus. And what it does is that it targets a particular enzyme in the virus to prevent the virus replication in human cells and the spreading of the virus. That way you end up with lower viral load in infected individuals and hopefully therefore reduce their ability to transmit the virus because they will shed less virus. So as we know, it's not specific to COVID-19. So all the tests have been done with just the hope that it may have a cross-reactivity to it. There's no solid data so far that is the case. There's data showing that it seems to help reduce the length of stay of infected people in the hospital from 15 days to 11 days compared to those that didn't receive it. But there's no solid scientific data showing that it specifically blocks the virus. They're also put on steroids and they're put on antibiotics like Z-Pap.
Okay, so it is one drug in an arsenal of medications that are used together to address different aspects of this viral infection.
That's correct. And so it's difficult to pinpoint on it, to point at any specific agent within that cocktail as being responsible for providing benefit to a patient.
Thank you, Jacob, for that great information. We'll pick this up on another segment of this. Really appreciate your help with this.